Okay, imagine this scenario, something I think, well, many of us might face. You're maybe in a new city, perhaps even a new country, right? And suddenly you or someone you love feels unwell.
Yeah, that's a tough spot.
And you need to explain symptoms, try and understand a diagnosis, or figure out how to navigate a hospital, maybe all in a language that isn't your first one.
Or even if it is your first language, medical jargon can be intense.
Exactly. Or maybe you're just trying to make sense of a complex medical report and the words just kind of blur into this wall of text you can't get through. That feeling, of being totally overwhelmed by information and really desperately needing to be truly well-informed and articulate right when clarity is most critical. It's a profound challenge.
It really is. Confusion is the last thing you need in those moments.
Well, today, we're aiming to cut through that noise.
Yeah.
We're going to act as your expert guides, if you will.
That's the plan.
This deep dive is designed to be your ultimate shortcut, like a comprehensive beginner's masterclass in essential medical English.
We've really dug into some excellent sources. Learning English PRO in particular has some incredibly well-structured lessons we've drawn from.
Right, and these cover, well, everything from the most basic terminology to the kind of intricate process of navigating a hospital, mastering those crucial emergency phrases.
And even getting into some really specialized areas like, say, pediatrics.
So this deep dive is absolutely for you listening right now, whether you're maybe thinking about a career in healthcare or you're actively working on enhancing your English for personal knowledge, for confidence in medical situations.
Or maybe you're just, incredibly curious about how this whole complex medical world actually communicates.
Our mission today is really to equip you with that confidence, that clarity, and that crucial understanding to sort of transform what might feel like a language barrier into a bridge.
A bridge to better understanding and communication.
So what exactly are we going to unpack today? We're starting right at the foundation, the absolute blueprint of the human body itself.
Makes sense. Got to start with the basics.
From there, we'll move into decoding discomfort, understanding common symptoms, and figuring out who the key professionals are, the people who provide care.
Knowing who does what. Crucial.
Then we'll dive into the practical stuff, the toolkit of treatments, and the vital language you need for urgent communication.
Yeah, the what happens next part.
After that, we'll carefully navigate the hospital environment, which can be pretty intimidating, let's be honest.
Definitely. Lots of moving parts there.
We'll then try to master some more nuanced medical vocabulary before taking a really fascinating detour into specialized fields, specifically pediatrics and the intricate respiratory system.
Getting into the specifics.
And finally, we'll arm you with practical, real-world phrases for communicating effectively in those moments of crisis.
Ready to use stuff.
It's quite a journey, really, into a truly fascinating and, well, undeniably crucial area of knowledge.
It absolutely is a vital journey. And as our main source, Learning English PRO really emphasizes again and again, the bedrock, the absolute foundation of effective medical communication starts with a really clear understanding of the human body.
That seems logical.
Yeah, to genuinely master medical English, you first need to grasp the core systems that, literally keep us functioning. Without that base, trying to describe what's wrong or even understand a diagnosis, it just becomes exponentially harder.
That makes perfect sense.
Yeah.
How can you even talk about health or illness if you don't get the fundamental structure it's all built on? So what are these foundational systems our source material really highlights as the crucial starting points?
Well, our deep dive into the material points to 6 major body systems as really indispensable starting points. They give you not just the core function, but also, crucial context for pretty much all medical conversations that follow.
Okay, 6 key systems. Let's hear them.
First up, we delve into the cardiovascular system. Think of this as the body's incredible internal superhighway.
Okay, I like that analogy.
It's defined as the system that tirelessly circulates blood all through the body, its main job, delivering essential oxygen and vital nutrients to every single tissue, every cell.
And taking away the trash, so to speak.
Exactly, while simultaneously carrying away waste products. It's that constant flow that sustains life. A really practical phrase that shows its context, taken right from our source, is the patient's cardiovascular system is healthy with no signs of heart disease.
Simple, direct. Tells you a lot.
Instantly. It tells you about the health of the heart, the blood vessels, the blood itself.
So we're talking the heart is the pump, obviously. And then this huge network of arteries and veins, just diligently keeping everything flowing, making sure every bit of the body gets what it needs. It's a marvel of engineering, really.
It truly is.
What's the next foundational system we need to get our heads around?
Next, we look at the respiratory system. This system includes the lungs and that intricate network of airways. It's solely responsible for the fundamental processes of breathing and, critically, gas exchange.
Breathing in, breathing out. Sounds simple, but it's vital.
Absolutely. It's how we take in the oxygen we need for life and efficiently get rid of carbon dioxide, which is a waste product. Think of it as the body's internal air filter and oxygen supplier.
Good.
The source gives a clear example phrase for this one, too. She is experiencing difficulty breathing, indicating a possible respiratory system issue.
Right, and that phrase immediately flags up a potentially serious problem with the lungs or breathing passages. Invaluable in an emergency.
Precisely. It directs attention right where it needs to be.
Absolutely crucial for survival. Okay, so if the cardiovascular system is the delivery network and the respiratory system handles the air exchange, what about how we actually fuel this incredible machine? Where does the energy come from?
Now you're thinking about the digestive system, which is exactly where we go next.
Makes sense.
This is a remarkable system. Its job is to break down the food we eat into nutrients the body can actually absorb.
Okay, so processing the fuel.
Exactly. These nutrients are then used by the body for critical functions, making energy, facilitating growth, and enabling the constant repair of cells. Think of it like the body's really sophisticated processing plant.
Got it.
The source suggests a useful phrase like, gastrointestinal symptoms suggest a problem within the digestive system.
Gastrointestinal, that sounds like a key term.
It is. And it's a great example of how specific medical English can be super efficient. If someone mentions gastrointestinal symptoms, even a beginner knows they're talking about issues with the stomach, intestines, or related digestive organs without needing a whole list of possible problems.
That's a fantastic point about efficiency. It really must streamline conversations with doctors and nurses, mustn't it?
Hugely. It gets everyone on the same page much faster.
Moving on then, what about the system that kind of orchestrates all of this, the command center?
Precisely. That leads us to the incredibly complex nervous system. This is essentially the body's central command and communication network. Pretty much. It controls both our voluntary actions, things like walking or speaking, and our involuntary actions like heart rate, breathing, or digestion, things we don't consciously control.
So it's the master controller, running everything from thoughts to reflexes.
You got it. A phrase to remember here, according to our source, is, after the accident, we're monitoring him for any signs of nervous system damage.
Okay, and that immediately tells you there's concern about potential injury to the brain or the spinal cord or that huge network of nerves running everywhere.
Exactly. Serious stuff.
So it's the electrical grid and the main computer all rolled into one. What about the actual physical framework? The structure that lets us move, stand up, interact with the world?
That takes us straight to the musculoskeletal system. This is our structural framework and our system for movement.
Bones and muscles, right.
Right. But also tendons and ligaments. It provides both support and movement through this intricate combination. It's what gives us our shape and enables basically all physical activity.
Makes sense.
Our source gives a clear example. The X-ray shows a fracture in the arm affecting the muscular skeletal system.
Okay. So it pinpoints the injury right within that specific system. Very clear for diagnosis and treatment.
Precisely. No ambiguity there.
And finally, the body's own incredibly sophisticated defense force, the protectors.
Our last major system for this foundational part is the immune system. This absolutely vital system is our body's internal army, you could say.
Fighting off invaders.
Constantly. Defending tirelessly against pathogens, diseases, and other external threats, it's responsible for identifying and neutralizing harmful invaders.
Crucial.
A phrase that clearly illustrates its critical function is, a weakened immune system can lead to frequent infections.
Right, which immediately explains the consequence of having a compromised defense system.
Yeah.
It gives context to why someone might be getting sick all the time.
Exactly. It connects the system's function to a real-world health outcome.
What's really striking here is how clearly Learning English P-Row lays out these foundational systems. It gives us such a solid base for, well, everything else we're going to talk about.
It really does.
Because beyond just memorizing the names, understanding these 6 core systems fundamentally changes how you might describe your symptoms, doesn't it? It makes talking to a doctor so much more effective.
Absolutely. You move beyond vague descriptions.
Yeah, you're not just saying, my stomach hurts, but you might actually start thinking about which system is affected. That could lead to more targeted questions for the doctor and hopefully faster understanding.
It empowers the patient, really.
It really creates a kind of comprehensive mental map of the body, which feels indispensable for clarity and, confidence when dealing with medical stuff.
Absolutely. This foundational knowledge really does streamline communication dramatically. It lets medical professionals quickly narrow down potential issues.
And for you, the listener, whether you're the patient or just an observer trying to understand, it helps you follow that nuanced medical dialogue.
Exactly. It shifts you from being just a passive recipient of information to being a more active participant in healthcare discussions.
Okay, so once we've built this fundamental understanding of the body itself, the next really crucial step is knowing how to talk about what's happening when things aren't quite right, when those systems aren't working optimally.
Right, describing the problem.
You need to be able to describe what you feel the symptoms and, crucially, understand who can actually provide help. Imagine waking up feeling unwell. The first words out of your mouth are probably about how you feel.
Which brings us straight to the language of symptoms.
Exactly.
And Learning English P.R.O. does a really excellent job detailing common symptoms, giving both precise definitions and memorable example phrases you'd likely hear or need to use yourself.
Okay, let's hear some common ones.
For instance, fever. This is basically an elevated body temperature. It's usually a clear sign of infection or some kind of illness, a universal indicator that something's off balance.
Got it. High temperature.
A practical example from the source. Gemma has had a fever for the past few hours. Simple, direct, immediately understood.
Okay. And that horrible feeling in your stomach, like you might be sick?
That's nausea. It's described as that feeling of unease or discomfort in the stomach, which often comes before actually vomiting.
Ugh. Yeah. Know that one.
A straightforward way to describe it is, she started to feel some nausea this morning. Then there's the incredibly common headache. This just refers to pain or discomfort felt in the head, scalp, or maybe the neck area.
And they can vary a lot, right? Mild to really bad.
Exactly. They range hugely in intensity. Vincent started to get a headache this morning in the library. Just shows how everyday and relatable this symptom is.
We've all been there. And what about that sensation of losing your balance or feeling like the room is spinning?
That's dizziness. It's a sensation often described as spinning, lightheadedness, or feeling like you're about to lose your balance.
What causes that usually?
It's often linked to maybe inner ear issues or sometimes low blood pressure, things like that. You might hear someone say, Ming laid down as she was experiencing some dizziness.
Okay. And that really deep tiredness that just won't go away no matter how much you sleep.
That's fatigue. And it's important to distinguish this isn't just everyday tiredness. It's an overwhelming sense of physical or mental tiredness, a lack of energy that is not relieved by just having a rest or a normal night's sleep.
So it's more profound than just being tired.
Much more. The source gives a really good example. Kate has suffered with extreme fatigue since she had a virus. That highlights the difference between just being tired and clinically significant fatigue.
That's a key distinction.
Finally, we have a cough. This is a reflex action where you expel air from the lungs with a sudden, often sharp sound. An example. One of the symptoms Edward had was a bad cough.
Right.
These are all pretty everyday terms, but knowing their precise medical context and how to articulate them clearly is absolutely key for effective communication with healthcare professionals.
So, okay, you've identified your symptoms, fever, nausea, whatever it is. You might even have an idea which body system is involved. What does this all mean when you actually need help? Who do you turn to?
Great question.
Because understanding the different roles within healthcare seems just as vital as knowing your symptoms. It's about knowing who does what, and importantly, when to call them.
Precisely. And Learning English P.R.O. meticulously outlines the key healthcare professionals, detailing their specific roles and giving a useful phrase for each. This really helps make navigating the system much more efficient.
Okay, who's first on the list?
First, we have the GP, which stands for General Practitioner. This is your primary care doctor. They diagnose and treat a wide range of common illnesses and health issues.
So your family doctor, basically.
Exactly. They are often your crucial first point of contact in the healthcare system. The example phrase is spot on. You should see a general practitioner if you're experiencing unexplained symptoms like persistent headaches or fatigue. They do that initial assessment and guide you.
They're kind of the gatekeepers, aren't they?
Yeah.
Guiding you to the right specialists if something more serious is going on.
Yeah.
What about nurses? They seem to be everywhere in healthcare settings.
Nurses play an incredibly broad and very hands-on role in patient care. They provide direct care and support to patients in all sorts of settings. They assist with medical procedures, and they're absolutely fundamental to patient education.
They do a lot.
They really do. A key phrase that highlights their immediate patient interaction and data gathering is, "The nurse will take your vital signs and update your health records before you see the doctor." It shows how integral they are to the whole patient journey.
Right. And when it comes to the actual medications, who is the ultimate expert you should always consult? The person who really knows the drugs inside out.
That would definitely be the pharmacist. They are the undisputed experts in medication. They're responsible for safely dispensing prescriptions, yes, but also for providing invaluable advice on the correct and safe use of those medications.
So more than just counting pills.
Much more. They are a crucial and often underutilized resource for understanding your drugs, potential side effects, and especially interactions with other medications you might be taking. The advice: always ask your pharmacist if this medication has any potential interactions with what you're currently taking, is vital. It can prevent serious problems.
That's really good advice. Okay, and if something needs to be physically repaired or removed, if it's, more than just a pill can fix,
Then you're probably looking at needing a surgeon. This is a highly specialized doctor who performs operation surgery to treat diseases, injuries, or deformities.
a very hands-on specialty.
Extremely. Their work is often critical, incredibly precise, and can be life-altering. The source's example really clarifies their role in patient communication. The surgeon explained the risks and benefits of the procedure during the consultation. They have to ensure the patient understands what's involved before they proceed.
Right, informed consent. And for very specific issues, like, say, a persistent skin rash or problems with your hair or nails, who handles that?
For those kinds of issues, you would consult a dermatologist. They specialize exclusively in treating conditions related to the skin, hair, and nails. They provide highly specialized, targeted care for those areas.
Okay.
For persistent skin rashes or acne, you should consult a dermatologist for specialized care. Each of these professionals plays a distinct and really important role. Knowing who does what helps you navigate the often complex healthcare system much more efficiently and effectively.
Yeah, it definitely empowers you to seek the right help at the right time for the right person.
Exactly.
Okay, here's where it gets really interesting for me, moving beyond just diagnosis to the actual action, the interventions that really define modern healthcare.
The treatments and procedures.
Right. Once you've understood the body, described your symptoms to the right professional, what happens next, what are the common treatments and procedures you might hear about or even, undergo yourself. This is the toolkit of healing.
Yeah, this section of our sources, especially Learning English PRO, provides a really clear toolkit of treatment options, detailing essential procedures and explaining their fundamental purpose.
Let's unpack that toolkit.
Okay, first, a prescription. Now, this isn't just a slip of paper. It's a doctor's official, legally binding order for a pharmacist to prepare and administer a specific drug or maybe a medical device for a particular patient.
So it's your official ticket to getting the medication you need.
Precisely. The example phrase is helpful. This prescription should help alleviate your symptoms within a few days. And that word alleviate is a great medical verb. It means to make suffering or a problem less severe.
Good word to know. So that's the gateway to medication. And then there's something we've all become incredibly familiar with recently, but its impact actually stretches back centuries in public health.
Exactly. You're talking about vaccination. This is the administration of a vaccine, a substance that helps the immune system develop vital protection from a particular disease.
It's proactive, right? Preventative.
Absolutely. It harnesses the body's own defenses before the threat even arrives. As the source emphasizes, vaccinations are absolutely crucial for preventing the spread of infectious diseases across whole populations. They literally transform public health by teaching our bodies to recognize threats.
A cornerstone of modern medicine. Okay, and for more serious, perhaps more invasive interventions, when medication alone isn't enough.
That's when surgery often comes into play. This is a medical procedure that involves making an incision, a cut into the body with instruments.
Why would they do that?
Well, it's performed for various reasons. To repair damage, maybe remove diseased tissue, or to arrest, meaning stop the progression of a disease within the body. It's often a very direct, powerful intervention. The surgery scheduled to remove the benign tumor clearly states its precise purpose in that case.
Okay, and after surgery, or maybe after certain injuries, recovery often involves more than just rest, doesn't it?
Definitely. Physical therapy often becomes absolutely vital for recovery. This is a structured treatment approach that uses various physical techniques, things like specific exercises, massage, sometimes heat or cold therapy.
What's the goal?
The goal is usually to relieve pain, improve mobility, how well you can move, and restore physical function. The source highlights its critical role. Physical therapy is recommended to recover from the knee injury, helps you get back on your feet, literally.
Makes sense. And then there's a word that I think for many people carries a lot of weight and often signifies a very serious battle with illness.
You're likely thinking of chemotherapy.
Yes.
This is a powerful treatment that involves using specific chemical substances, primarily drugs, to treat diseases like cancer.
How does it work, generally?
It works by targeting and killing, or at least stopping the growth of, cancerous cells. Chemotherapy is a common treatment for various types of cancer, the source states, emphasizing how prevalent it is as a frontline therapy in oncology.
Okay. And one more diagnostic tool you mentioned, something to confirm what's going on.
Right, a biopsy. This is a critical diagnostic tool. It involves removing a small sample of cells or tissues from the body.
And then what happens to the sample?
It's sent for microscopic examination by a specialist called a pathologist. This is done to check definitively for illness or disease, helping to confirm or rule out conditions, especially things like cancer. A biopsy will be performed to examine the tissue for signs of disease, clearly indicating its diagnostic purpose.
Got it. So that's a good overview of common treatments. But what about those moments when, time is absolutely critical, when there's no time for detailed explanations or fancy vocabulary, and you just need to communicate urgently and clearly?
High stress, high stakes situations.
Exactly. In those moments, every single word counts, doesn't it?
It absolutely does. That's why learning English pre-row puts such a strong emphasis on these crucial emergency phrases. Their conciseness and clarity are absolutely paramount in urgent situations.
Give us some examples.
For instance, I need an ambulance. It's direct, unmistakable. You use it in a life-threatening situation that needs immediate, professional medical attention. Leaves absolutely no room for doubt about the severity.
Short, direct, incredibly impactful. It's by getting the right help right now.
Absolutely. Another vital one, it's an emergency. He's having trouble breathing. This not only instantly alerts medical personnel to the urgency, but also concisely tells them the specific nature of the crisis, a respiratory emergency.
Okay, gives them crucial info fast.
Then there's the incredibly critical phrase, I'm allergic to penicillin, or any other allergy, of course.
Why is that one so important?
This information is vital to communicate immediately upon any medical contact to avoid severe, potentially life-threatening adverse reactions, especially if they need to give you medication in an emergency. It can literally be life-saving.
That's one of those crucial details someone might easily forget in a panic, but it's paramount for safe care.
Exactly. She's unconscious is another key phrase. It indicates a serious, non-responsive condition requiring immediate medical evaluation. Simple, clear.
Right. And if you witness something,
if you're reporting an incident or situation, there's been an accident, is the most direct and universally understood way to report something that requires emergency medical services, or EMS.
Okay.
Lastly, a phrase like, I think it's a heart attack, directly describes symptoms strongly suggesting a heart attack, prompting immediate, specialized action from emergency responders.
Yeah, it gets the right protocols going.
These phrases are meticulously designed for maximum information transfer with minimal words, ensuring clarity and speed in the most high-stress situations. Understanding, and maybe even mentally rehearsing these, can make a profound difference.
It's incredible how just a few precise words can convey so much information and trigger such specific life-saving responses in a crisis. Okay, now let's take that deep dive into the hospital itself, this often complex, yet hopefully highly organized environment.
Yeah, it can feel like a maze sometimes.
What can you expect to see? Who will you meet? And crucially, what kind of language will you hear buzzing around within its walls? It's really a microcosm of specialized terms and roles.
Navigating a hospital can definitely be daunting for anyone, let alone someone trying to do it in a language that isn't their native tongue. Our source, Learning English PRO, gives a really comprehensive overview of the essential vocabulary you're likely to encounter.
Okay, lay it on us. Where do we start?
Firstly, the word hospital itself actually has several synonyms that are good to know. Medical institution, medical facility, health center, and sometimes just clinic, though clinics are often smaller or more specialized.
Right. Good to recognize those variations. Why do people typically go to a hospital?
Well, people visit hospitals for a whole host of reasons. obviously for surgery, to receive ongoing therapy, for various kinds of testing or examination, maybe for a consultation with a specialist, or just a regular checkup, or even simply visiting a loved one who's a patient there.
Okay, what's the difference between a consultation and a checkup in this context?
Good question. The source clarifies that a consultation is specifically a meeting with an expert, like a specialist doctor, to seek their advice and get an evaluation. A checkup, on the other hand, is usually an appointment where an existing disease or illness is being monitored, often for regular ongoing patients.
Got it. So it's not just about emergencies, it's about planned care, ongoing monitoring, and even just visiting. That's an important distinction, actually. It kind of shifts our perception of what a hospital is for.
It does. And once you're actually inside, how do you find your way around this often sprawling place?
Yeah, good question. They can be huge.
Hospitals are usually very precisely organized into different areas, commonly called departments or wards. To find your way, you can always ask for help at the main help desk or reception area, usually near the entrance.
Okay, look for the main desk.
And within pretty much every ward or department, you'll find a central nurse's desk or nurse's station where you can seek further information or assistance specific to that area. Of course, many people arrive at a hospital because of an emergency, which, as we said, is defined as a serious, unexpected, and often dangerous situation needing immediate medical action.
How do they usually arrive in an emergency?
In those cases, an ambulance will likely bring you to the emergency department. The first person on the ambulance team who assesses your condition is usually called a paramedic. And if needed, you'll be quickly placed on a stretcher, which is that specialized mobile bed used to carry patients quickly and safely.
Okay. And once you're under their care, what are you actually called? And is there a difference if you're staying overnight versus just coming in for an appointment?
When you are receiving any kind of medical care, you are universally called a patient. Now, if your treatment requires you to stay overnight, or maybe for several days or weeks, you are officially an inpatient. This means you've been admitted to the hospital.
Okay, inpatient means staying over.
Right. If, however, you stay at home while getting treatment and just come into the hospital by appointment for your care, maybe for dialysis or chemotherapy, you are referred to as an outpatient.
Inpatient versus outpatient. Got it. What happens when you arrive?
Upon arrival, and especially if you're being admitted as an inpatient, you'll typically undergo an initial assessment or examination by a doctor to determine your condition and figure out the best plan for your care.
We've touched on the roles of doctors and nurses already, but learning English PR goes into some interesting detail about their typical appearances and the essential tools they carry, doesn't it?
Yes, it does. It highlights that one tool you will almost always see a doctor carrying, or often draped around their neck, is the stethoscope.
The classic doctor tool.
Exactly. That iconic instrument is primarily used to listen to a patient's heartbeat, their lung sounds, and other internal body sounds. Doctors are also widely recognized for wearing a white coat, so much so that they are sometimes informally just called white coats.
Right. What about those blue or green outfits you see?
Increasingly, you'll also see medical staff wearing scrubs. These are typically blue or green, sort of pajama-like clothing worn for hygiene and protection, especially in sterile environments like operating rooms or during surgery.
And during surgery itself, they wear even more gear.
Yeah. Oh, yes. During surgical procedures, doctors wear a specialized surgical gown over their scrubs, a face mask, protective goggles to shield their eyes, and sterile gloves, all to maintain a sterile field and protect both themselves and the patient from infection.
Makes sense. What about the nurse's specific tools or responsibilities in the hospital setting?
Nurses, as absolutely vital hospital employees, are responsible for managing the patient chart, or patient file, that crucial document containing all of your medical records, treatment plans, observations, everything.
Keeping track of everything.
Exactly. They also regularly take your vital signs, things like your blood pressure, body temperature, pulse rate, and respiration rate. And of course, they frequently dispense medication to patients according to the doctor's orders.
Speaking of medication, what are the different forms and types you might encounter in a hospital beyond just a simple pill? The delivery methods seem quite varied.
They really are. Medication, which is also commonly referred to as medicine or drugs, is indeed given in various ways, each suited to different conditions and patient needs.
Like how?
Well, it can be administered by injection, using a syringe and needle. This is often done for rapid absorption or when taking something orally isn't possible or effective.
Okay, a shot.
Right. It can obviously be taken orally, usually in the form of pills or tablets. For continuous administration, or if large volumes of fluid or medication are needed, it can be given via an IV drip.
What's that stand for?
It's short for intravenous drip, meaning directly into a vein. This often involves a saline bag just for hydration, or sometimes a blood bag for blood transfusions.
Okay, got it.
Yeah.
What are some common types of drugs used in hospitals?
Common types of medication that almost everyone will encounter at some point include painkillers for pain relief, antibiotics specifically for bacterial infections, antiviral drugs for viral infections, or maybe steroids to reduce inflammation or treat certain chronic conditions.
And how do you get these?
After your doctor decides on the best course of treatment, you'll receive that prescription, which, as we said, is the signed document you take to the hospital pharmacy or an outside pharmacy to actually obtain your medication.
Okay. And for figuring out what's wrong in the first place, beyond just a physical examination, there are loads of different advanced scans and tests nowadays, aren't there?
Absolutely. Technology has advanced incredibly. The source lists common scans or testing methods that provide detailed internal images of the body.
Like what?
These include X-rays, which use radiation primarily to visualize bones and dense tissues. Then there's MRI, which stands for magnetic resonance imaging.
What does that show?
MRI uses strong magnetic fields and radio waves, no radiation, to create very detailed images of organs and soft tissues like muscles, ligaments, and the brain. Then you have CT scans or computerized tomography.
How is that different from an X-ray?
A CT scan combines a series of X-ray images taken from different angles around your body and uses computer processing to create cross-sectional images or slices. It gives more detail than a standard X-ray. And then there's ultrasound.
That's the one used in pregnancy, right?
Very commonly used in pregnancy, yes, but also for looking at other organs. It uses high-frequency sound waves to create images again, no radiation. A very frequent diagnostic test is simply a blood test, sometimes also called a blood screening, which can reveal a huge amount of information about your general health, infections, organ function, and so on.
So many ways to look inside. What if someone is quite ill and needs close watching?
Right. For serious conditions, patients might need to stay in the hospital specifically for observation or monitoring, so the staff can meticulously track their recovery or the progression of their condition.
And if they're really sick?
Very serious cases often require admission to the intensive care unit, universally known as the ICU. And if there's significant difficulty breathing, oxygen support may be needed.
How is oxygen given?
It can be delivered simply via an oxygen mask over the nose and mouth, or through more advanced equipment like a ventilator or resuscitator, which actively helps the patient breathe.
Okay. What about after surgery or a serious injury? The recovery process sounds like it involves a lot of specialized equipment and very specific care.
It certainly does. Surgery, as we touched on, can be performed for a whole range of reasons. For diagnosis, like taking a look inside, to perform a biopsy, for removal of diseased tissue like a tumor, for repositioning of bones or organs after an injury, sometimes to redirect blood flow, like in heart bypass surgery, or for complex transplants of organs.
And after the operation, what kind of things help with healing?
After surgery, bandaging is very common. This uses various types of bandages, which might be compression bandages to help reduce swelling or elastic bandages for support. A dressing is specifically a sterile bandage applied directly to cover and protect a wound.
What else might be used on a wound?
Other common aids include medical gauze, which is great for absorbing fluids, adhesive tape for securing dressings and bandages, cotton wool for cleaning or padding, and that everyday item, a Band-Aid, which is more common in American English, or a plaster, more common in UK English. The general term is an adhesive bandage.
Okay. What about for broken bones? That seems like it needs more serious support.
Absolutely. For broken bones, a plaster cast, also just called a cast, or sometimes plaster of Paris, although newer synthetic casts are common now, is used to immobilize the limb and allow the bone to heal in the correct position.
Is there anything less bulky than a full cast?
Yes, sometimes a splint is used, like a leg splint or a finger splint. This is usually a rigid piece of material used for temporary support and immobilization. Maybe before a cast can be put on or for less severe fracture.
Any other supports?
Similar supports include things like a wrist support, a support boot, sometimes called a brace boot for foot or ankle injuries, and various types of braces designed for the leg, neck, back, or even the whole body, providing stability. For a broken arm, a sling is commonly used to support and immobilize it against the body.
And if someone can't walk easily after an injury or surgery?
For mobility assistance, patients might use crutches to take weight off an injured leg. A Zimmer frame, or walker, provides more stability for those who need extra support when walking. And of course, a wheelchair is used for patients who are unable to walk independently, either temporarily or permanently.
That's a lot of gear. Are there specific wards or departments within a larger hospital for different types of care or certain patient groups?
Yes, absolutely. Hospitals are often highly specialized internally. For women giving birth, for example, there's usually a dedicated maternity or labor ward. Larger cities might even have a whole separate maternity hospital.
Okay.
Hospitals also play a crucial role in convalescence, which is a slightly formal word referring to the period of rest and recovery after surgery or a serious illness. It's the getting better phase.
And when it's finally time to go home?
When a patient is deemed medically stable and ready to leave, the doctor and hospital will officially discharge them. Discharge is the formal authorization to release a patient from medical care and allow them to return home, often with follow-up instructions.
Wow. When you really think about the sheer number of specialized terms, roles, equipment, procedures involved, I mean, from the minute you walk into reception to the moment you're discharged, every interaction, every piece of kit, every type of care has its own specific language.
It really does.
It truly highlights why this deep dive is so vital for gaining clarity and confidence in such a critical environment. It's almost like learning the specialized language of an entire new country, with its own specific dialect.
That's a great analogy. The hospital environment is a microcosm of highly specialized language, and understanding these terms definitely makes the patient's journey or any interaction with the healthcare system far less intimidating. It removes a huge barrier to effective care.
Okay, now let's zoom in a bit more. Let's focus on the active words, the verbs that describe actions, and also the different forms healing can take via medication, and maybe some more specific terms that really help make you well-informed in medical English.
Moving beyond just naming things to understanding processes.
Exactly. We're going beyond just nouns and into understanding the processes and nuances.
Okay, well, Learning English P-Row provides an excellent list of specific healthcare verbs and also phrasal verbs, meticulously clarifying their meanings and showing how they're used across different tenses, which is really helpful.
Let's hear some P ones.
For instance, to administer. This basically means to give medication or treatment. In a future context, you might hear a nurse say, "The nurse will administer the painkiller to the patient by injection in a few minutes."
Okay, to give.
Or in the past tense, "The doctor administered the life-saving treatment just an hour ago." Then there's care for. This is a really crucial phrasal verb, meaning to help and protect someone, to look after them with attention and empathy.
The human side of medicine.
Very much so. The nurses consistently care for the patients with remarkable dedication. Or, looking ahead, I will be caring for the patient's specific needs throughout the night.
So it's not just about the medical procedure itself, but that essential human element of nurturing and looking after someone.
Exactly. To assist means to help someone, or maybe to be present as a helper during a procedure or situation. For example, 2 midwives assisted at the birth yesterday, ensuring a smooth delivery.
Okay, helping out.
And in the future, the resident doctor will assist the lead surgeon during the complex operation tomorrow. Then, to determine. This means to ascertain or establish exactly why something is occurring, often through investigation or examination.
Finding the cause.
Right. The diagnostic tests determine that the issue is muscular, not neurological. Or, the research team will work tirelessly to determine the cause of this mysterious illness.
A polite and compassionate way to talk about something very difficult, like death, is often needed in medical settings, isn't it? Language plays a huge role in empathy there.
It absolutely does. Sensitivity is key. To pass away is a common, polite, and sensitive phrasal verb meaning to die. Sadly, the patient passed away earlier this evening, surrounded by family.
A gentler way to say it.
Or perhaps forecasting, unfortunately, given the prognosis, the patient will likely pass away soon. A different kind of verb, to sever. This means to divide something by cutting or slicing, often suddenly and completely, usually used for injuries.
Ouch. Like in an accident.
Exactly. The patient tragically severed her index finger in a kitchen accident. Or maybe in a planned procedure. During the delicate operation, the surgeon will carefully sever the nerve to relieve chronic pain.
And that key action a doctor performs to authorize the medication you need. We mentioned prescription earlier.
Right. The verb is to prescribe. This means to officially advise and authorize the use of a specific medicine or treatment, usually in writing, for a patient. The doctor prescribed a powerful new medication for his chronic pain.
Or maybe refusing to.
Yes, proactively. The doctor will not prescribe any more medication to you if you don't follow the instructions carefully. Another common phrasal verb to come down with. This means to become sick with an illness, often a common one like a cold or the flu.
Like, I feel like I'm coming down with something.
Exactly. I'm starting to feel under the weather. I think I'm coming down with a case of the flu. Or, in the past, during the winter, many of the students came down with a bad cold.
And when a wound needs to be closed up properly, beyond just slapping on a bandage.
To suture means to stitch up a wound or incision, typically using a special medical needle and thread. The emergency medic quickly sutured the wounds of the accident victims right there at the scene.
Wow.
And looking ahead, the surgeon will suture your wound meticulously after the operation to minimize scarring. Then we have two really important contrasting verbs related to consciousness.
Okay.
To pass out, which means to lose consciousness, often temporarily, like fainting. She will likely pass out if she sees the injection needle due to her phobia, or after a few minutes of intense pain, the patient passed out.
And the opposite, waking up.
Exactly. The direct opposite is to come to, meaning to recover consciousness or wake up after fainting or anesthesia. The patient slowly came to after the surgery and was disoriented, but okay. And we expect she will come to in a few minutes as the anesthesia wears off.
So critical to know if someone is responsive or not, especially in an emergency situation. Passed out versus coming to.
Indeed. To inject, as we mentioned with administration, means to introduce a liquid, like a drug or vaccine, into the body using a syringe and needle. The nurse injected the painkiller, and I began to feel much better within minutes.
Or maybe more directly.
Yes, he will inject the medicine directly into the patient's vein for rapid effect. Then, to fight off. This means to defend against an illness or disease, often using the body's own immune system.
Like fighting off a cold.
Exactly. The patient has shown remarkable resilience and has fought off the infection very well, or we hope her immune system will fight off the virus in her stomach effectively. To massage means to rub or knead a part of the body, often to relieve pain or muscle tension.
Like in physical therapy.
Yes, or just for comfort. The patient gently massaged their head with the soothing ointment, and the physical therapist will massage the patient's shoulders to improve blood flow. Finally, to ache. This means to suffer from a continuous dull pain rather than a sharp or throbbing one.
Like a muscle ache.
Precisely. The patient complained that her leg aches badly, especially after standing for a long time. And maybe anticipating, my back will definitely ache tomorrow if I lift those heavy boxes without proper technique.
That's a really powerful set of action words. They truly bring medical scenarios to life, giving us a vocabulary to describe exactly what's happening. Okay, what about different types and forms of medicine itself, beyond just saying pills? The way medicine is delivered seems just as important as the medicine itself sometimes.
It really can be, and the source covers this thoroughly, which is essential for a really comprehensive understanding. When it comes to specific symptoms and the associated medication, the targeting is key.
Meaning specific drugs for specific problems.
Exactly. For a bacterial infection, you'll definitely need an antibiotic. If it's a viral infection, the treatment will be an antiviral. Antibiotics don't work on viruses.
It's a common misconception, isn't it?
It is. For general pain or fever, a painkiller like paracetamol or ibuprofen is the usual go-to. For a persistent cough, you might use cough syrup, cough medicine, or a specific cough suppressant, depending on the type of cough.
Okay.
For allergies, an antihistamine is typically prescribed or recommended to block the body's histamine reaction. If someone has asthma, a steroid is often prescribed, usually inhaled, to reduce inflammation in the airways.
Right.
For a blocked or stuffy nose, a decongestant helps clear the nasal passages, often as a spray or tablet. And of course, in recent times, we've all become acutely familiar with the concept of a vaccine specifically designed to provide immunity against viruses like the coronavirus.
So the medicine is precisely tailored to the specific type of ailment. That makes perfect sense for effective treatment. And the actual physical forms these medicines take, you mentioned pills, liquids.
Yeah, medicine can come in a surprising variety of forms, each optimized for different delivery methods and absorption rates. It's often in liquid form, sometimes as a thick, sweet syrup, which is particularly common for children or for treating coughs and colds.
Easier to swallow sometimes.
Right. Liquids can also be given directly by injection or straight into the bloodstream via an IV line, as we discussed. The most common forms, familiar to most people, are the solid tablet or pill, usually round or oval.
No.
There are also soluble tablets that are designed to dissolve quickly in water before you drink them. A capsule is typically a gelatin shell containing the medicine, often in powder or granule form, designed to dissolve once swallowed.
What about for sore throats?
For mouth or throat symptoms, you might use a lozenge, which is like a small medicated candy that slowly dissolves in your mouth, delivering the medicine locally. For topical applications, meaning applied to the skin, you'll find cream, lotion, or ointment. They vary slightly in consistency and base.
Okay, stuff you rub on.
Exactly. For eyes or ears, there are specific drops. And for nasal passages or certain skin conditions, a spray can be used. Finally, an inhaler is that device specifically designed to deliver vaporized or powdered medicine directly into the lungs, commonly used by people with asthma or other respiratory conditions like COPD.
That's a huge array of ways medicine can be delivered, each with its own specific purpose and method of use. It's not just take 2 pills. Okay, and what's the difference between something you can just pick up off of shelves at the pharmacy or supermarket versus something a doctor absolutely has to approve? That seems like a really crucial distinction for safety and efficacy.
It absolutely is, and Learning English Piro clearly highlights this critical difference. That's the distinction between over-the-counter OTC drugs and prescription drugs.
Okay, OTC versus prescription.
Over-the-counter medicine can be purchased without a doctor's consent, without a prescription. They're often readily available in drugstores, pharmacies, and in some countries, even supermarkets.
What are they usually for?
Generally for minor ailments, mild pain, colds, allergies, that sort of thing. They typically have a wide safety margin when used as directed. Prescription drugs, however, are entirely different. They require a doctor's explicit consent, which comes in the form of that signed paper document called a prescription.
And you can only get them where?
They must be purchased or dispensed at a registered pharmacy or chemist. This distinction is absolutely crucial for patient safety, ensuring that more powerful medications or those needing careful monitoring are used appropriately and under medical supervision.
Right, prevents misuse and ensures the right drug for the right person.
Yeah.
This comprehensive vocabulary covering everything from active verbs to the specific forms of medicine and this OTC prescription difference. It really feels like building a robust bridge to understand and communicate effectively in almost any medical situation.
It really does. It empowers you to describe accurately, ask informed questions, and comprehend what's being said to you.
What truly stood out to you in that final list of additional vocabulary the source provided? Those terms that kind of push us beyond the absolute basics into more nuanced territory.
Well, the sheer breadth, as you say, is remarkable. It goes from simple descriptive terms we all recognize, like a runny nose or a chesty cough, a cough where you're bringing up phlegm,
Right.
to more nuanced conditions like a nervous breakdown, which is a term for severe emotional distress, or a relapse, which specifically means a deterioration in someone's health after a period of improvement. These paint a much fuller picture of the patient experience.
What else?
The source also includes practical hospital terms like health hazard, something posing a risk, and drip, which, as we discussed, is just the common shorthand for an IV drip. And descriptive terms like chill, meaning that feeling of coldness, often with shivering, that can indicate a fever is starting or spiking.
Any other roles mentioned?
We also see specialized roles beyond the ones we covered earlier, like a cardiologist who is specifically a heart specialist. The inclusion of terms like NHS, the National Health Service in the UK, and Medicaid, the US federal and state program for those with limited income, highlights the systemic and often national aspects of healthcare delivery.
That's a good point. It's not just individual interactions.
Exactly. And then there are useful verbs like alleviate, which we mentioned means to make suffering or a problem less severe, and adjectives like responsive, meaning reacting quickly and positively, which is often used to describe how a patient is doing. Even everyday items needed for recovery, like crutches and broader concepts like therapy, are detailed.
Anything else catch your eye?
Finally, that wonderful idiom, as fit as a fiddle, meaning in excellent physical health, it adds a touch of human warmth and relatability to what can sometimes feel like purely cold technical language. This extended vocabulary really elevates one's ability to engage with medical topics beyond just the basic survival phrases. It adds richness and precision.
Now let's go even deeper. Let's get into some fascinating specialized areas that truly reveal the complexity and the nuance of medicine. Our source, Learning English Pre-RO, provides an incredible look into pediatrics, the medical care of children, and then a really detailed breakdown of the intricate respiratory system.
Yeah, this really emphasizes the level of precision and specific knowledge required in different medical fields. It's not all the same. First, pediatrics. This is the crucial branch of medicine focusing specifically on the medical care of infants, children, and adolescents or teenagers.
Is there a set age range for that?
The age cutoff for pediatric care can vary slightly by region. In the U.S., it's typically up to age 21, while in many other parts of the world, it's usually around 18. The specialist doctor who treats children is, of course, called a pediatrician.
So it's definitely not just a case of treating smaller adults, is it? There must be a profound historical and fundamental reason why this specialization even exists. Why are children treated so differently in medicine?
Exactly right. They're not just miniature adults. While you can find traces of specific medical care for children way back in ancient India and Greece, modern pediatrics as a distinct medical specialty really began to formalize in the 18th century. A Swedish physician, Niels Rosen von Rosenstein, is often credited as a key founding figure.
When did the first children's hospital appear?
The first generally accepted pediatric hospital, the Hospital des Enfants Malades Hospital for Sick Children, opened in Paris way back in 1802. The crucial reason for this distinct field is the substantial physiological difference between the body of a child and that of an adult.
Oh, so.
Children's bodies are in a constant state of growth and development. Their physiological systems function very differently across various developmental stages: infancy, childhood, adolescence.
That's a powerful point. So what are some of these specific physiological differences or maybe unique concerns that are much more prominent or even exclusive to pediatric medicine compared to adult care?
Well, pediatricians naturally have a much greater concern for things like congenital defects. These are structural or functional anomalies, problems that occur during pregnancy and are present at birth.
Also known as birth defects.
Exactly. Also called birth defects, birth disorders, or malformations, conditions a child is born with. There's also a significant focus in pediatrics on genetic variation, the diversity in gene frequencies that can lead to differences between individuals. This often manifests in genetic conditions or syndromes that might present during childhood.
What else is unique to kids' health?
And, very importantly, developmental issues. This includes delays or abnormal patterns in areas like communication and language development, motor skills, problem-solving abilities, or social and adaptive behavior. Pediatricians carefully monitor a child's development against established age-appropriate milestones to identify and address any potential issues early on.
So it's really about catching developmental problems early and understanding the unique, constantly evolving biological makeup of a growing human being. Does this also profoundly affect how medication is handled? Like how drugs are dosed for children?
Absolutely. It's a critical difference and a major area of pediatric focus. A child's unique physiology directly impacts how drugs work in their body, making dosing and even the choice of medication entirely different from adults.
Can you give an example?
Sure. Take absorption, for instance. That's how drugs move from where they're administered into the bloodstream. Infants, for example, have different stomach acid levels and thinner skin compared to adults, which affects how oral or topical medications are absorbed.
Okay, so how it gets in is different. What about once it's in the body?
Then you have distribution, which is the movement of a drug to and from the blood and various body tissues. This is also significantly different. Children often have a larger volume of distribution for water-soluble drugs because their body composition, the ratio of water, fat, muscle changes dramatically as they grow.
What does that mean for dosing?
It means the same dose per kilogram of body weight might actually be less concentrated in a child's system compared to an adult's, directly impacting how much drug is needed to be effective. Then there's metabolism.
Breaking the drug down.
Right, the chemical breakdown of drugs, primarily done by enzymes in the liver. This varies significantly by developmental stage. A newborn's liver metabolizes drugs very differently than a toddler's or a teenager's liver does. And finally, elimination.
Getting rid of it.
Yes, the removal of drugs and their waste products from the body, mainly via the liver and kidneys. This is also different. Infants and young children, for instance, often have increased renal clearance. Their kidneys filter out certain medications faster than an adult's kidneys would.
Wow. So dosages and even the types of medications literally cannot just be scaled down proportionally from adults. It requires entirely different, highly specialized knowledge.
Precisely. Pediatric pharmacology is a complex field in itself.
And then there's the whole ethical side, which seems particularly complex with children, this idea of pediatric autonomy. How does that concept work in healthcare when the patient is a child?
This is a truly profound and often very complex area in practice. Autonomy, generally speaking, is defined as the capacity to make an informed, uncoerced decision, having freedom from external control.
But kids can't always do that, right?
Exactly. In pediatric healthcare, a major difference from adult care is that children, in most legal systems around the world, generally cannot legally make major medical decisions for themselves in the same way adults can.
So who decides?
This raises fundamental issues of guardianship: who has the legal authority to make decisions for the child. It also involves issues of privacy: what information about a child's health can be shared and with whom, and legal responsibility for medical outcomes. And crucially, the process of obtaining informed consent for procedures.
How does informed consent work if the child can't consent?
All these considerations must always be carefully addressed in every pediatric procedure. Usually, the parents or legal guardians are the primary decision makers, and they are expected to act in what they believe is the child's best interest. It's a very delicate balance of medical judgment, ethical principles, and legal requirements.
That's a deep and often a complex area in itself, isn't it? Blending medicine with legal and ethical considerations in a very practical, everyday way for pediatricians. Okay, moving on from the broad topic of pediatrics, our source also provided a fantastic deep dive into a specific, absolutely life-sustaining body system, the respiratory system.
Yes, this section really highlights the intricate anatomy involved in breathing and the associated vocabulary that's vital for discussing lung health and related conditions.
Take us through the parts.
Okay. The respiratory system is fundamentally responsible for breathing. The main organs are the lungs, which are typically referred to as a pair in the human body. Below them sits the powerful dome-shaped muscle called the diaphragm, which contracts and flattens to help pull air into the lungs during inhalation.
Where does the air actually enter?
Air first enters usually through the nose, specifically through the nostrils. It then passes into the nasal cavity and past the paranasal sinuses, which are air-filled spaces in the skull bones around the nose. Air can also enter, of course, via the oral cavity, the mouth.
And then where does it go?
From there, it travels down to the pharynx, which is the part of the throat behind the mouth and nasal cavity. Then it moves down into the larynx, commonly known as the voice box, which contains the vocal cords. Below the larynx is the trachea, often called the windpipe.
That's the main tube, right?
Yes. The trachea then branches at a specific point called the carina of trachea into the right and left main bronchus, one going to each lung.
Carina, that's a new one.
Yeah, the carina isn't just an anatomical landmark. It's incredibly sensitive. It's lined with nerves, and it's often the spot where your cough reflex is powerfully triggered if anything other than air tries to go down, or if there's irritation.
Ah, okay. Good defense mechanism. What happens after the bronchi?
The main bronchi further divide into smaller and smaller tubes called bronchioles, like the branches of a tree getting smaller and smaller. These bronchioles finally lead to the tiny air sacs called the alveoli.
And the alveoli are important because...
These microscopic sacs, millions of them in each lung, are the critical site where the actual gas exchange happens. Oxygen from the air you inhaled passes through the thin walls of the alveoli into the bloodstream, and carbon dioxide, the waste gas from your body, passes from the blood into the alveoli to be exhaled.
Wow, an incredibly intricate system. What specific vocabulary helps us describe what's happening within this system, both when it's functioning perfectly and, when it's struggling?
Learning English pre-row clarifies several key terms here. First, the basic difference. To breathe is the action verb, the process of taking air in and expelling it, while breath is the noun, referring to the air itself that you inhale or exhale. Take a deep breath.
Got it. Verb versus noun.
Oxygen, of course, is the colorless, odorless gas that is absolutely essential for life. In medical settings, you'll often hear about oxygen tanks for storing supplemental oxygen, or an oxygen supply system in a hospital, ensuring patients receive adequate amounts if needed.
Okay. What about common conditions?
Asthma is a very common chronic condition where the airways become inflamed, narrow, swell, and often produce extra mucus. This leads to symptoms like difficult breathing, coughing, often a characteristic whistling sound called wheezing, and shortness of breath.
How is it usually treated?
It's commonly treated with medications like steroids, often delivered via an inhaler, to reduce inflammation and open the airways. The general term airways itself just refers to all the passages from the nose-mouth down to the alveoli by which air reaches the lungs.
What about mucus? Is phlegm the same thing?
Good question. Mucus is a general term for the slippery, protective fluid produced by lining tissues throughout the body, like in the nose and sinuses. Phlegm, however, is a more specific type of thick mucus produced specifically in the lungs and the lower respiratory tract, often expelled by coughing when you have a chest infection.
Ah, okay. Phlegm is from the chest. What about feeling breathless?
Shortness of breath is that uncomfortable, often alarming condition where a person feels they just can't get enough air in. The specialist doctor for the lungs is a pulmonologist, a physician who focuses specifically on diagnosing and treating diseases of the respiratory system.
Pulmonologist, got it.
Both cough and sneeze can be used as nouns or verbs. They describe those often forceful, voluntary, or involuntary acts to clear the respiratory passages of irritants or mucus. A chest infection is a common term for an infection affecting the lungs or the large airways.
Like bronchitis or pneumonia.
Exactly, such as bronchitis, which is often viral, or pneumonia, which is often bacterial. These infections are typically spread through droplets from coughing or sneezing. Finally, the verbs to inhale means to breathe air in, and to exhale means to breathe air out. The corresponding nouns are inhalation and exhalation.
This really raises an important question for me. Just how much more is there to learn and specialize in within the vast field of medicine? It feels truly endless.
It really is.
Each body system, each age group like pediatrics, each specific condition like asthma, they all seem to have their own entire universe of specialized knowledge and vocabulary.
That's very true.
It really underscores the immense complexity and the incredible dedication involved in becoming a medical professional. And also why having this kind of language shortcut, this foundation we've discussed, is so incredibly valuable for anyone interacting with the healthcare system. It's like trying to navigate an ever-expanding library, isn't it?
It's an incredibly vast and constantly evolving field, absolutely. This deep dive, as comprehensive as we've tried to be, has really only scratched the surface of what's possible to know. But hopefully it undoubtedly provides the essential tools, the foundational vocabulary, and the conceptual frameworks to begin navigating that immense complexity with much greater confidence and clarity.
I think it does.
The human body and the science of healing it are truly lifelong studies, even for the experts.
Absolutely. Okay, to wrap up our deep dive today, let's equip you, the listener, with some indispensable communication tools specifically for those critical moments. Because, as we've said, knowing the vocabulary is one thing.
But using it effectively under pressure is another.
Exactly. Knowing how to use it effectively when stress levels are high and time is absolutely of the essence is a whole other challenge. These are the really practical phrases for real-world scenarios.
Yeah, this final section from Learning English PRO focuses squarely on practical phrases, categorized for clarity and immediate use, turning all that knowledge we've discussed into actionable communication.
Okay, let's start with first aid situations. What questions should you ask?
In First Aid English Asking Questions, the focus is on quickly and efficiently assessing the situation, getting vital information from someone who might be injured or suddenly unwell. You'd ask very direct, simple questions like, "Are you okay? Where does it hurt? And can you breathe normally?" These are designed to get immediate, crucial responses.
Simple questions that get right to the heart of what's happening, cutting through any confusion.
Exactly. Then, for First Aid English Offering Help, the phrases are designed to provide immediate assistance and, importantly, essential reassurance, especially if you happen to have some first aid knowledge yourself.
What did you say?
You could say, "I know first aid, can I help?" Or simply, "Stay calm," which can be incredibly important to help manage panic, both theirs and potentially yours. Also, help is on the way to provide reassurance that professional help has been called. And maybe a practical instruction like keep the wound clean and covered if applicable. These are vital for maintaining composure and providing concrete support.
Okay. And when you need to bring in more professional help to escalate the situation beyond basic first aid.
For First Aid English Seeking Help, these phrases are designed to effectively and urgently call for assistance from others nearby or over the phone. You'd state clearly and loudly if necessary. Call an ambulance immediately. We need a doctor. Or ask around, is there a first aider nearby? These ensure you get the right level of professional intervention as quickly as possible.
Right, mobilizing help. Now let's shift to inside the hospital environment. Beyond those initial emergency phrases we covered, what are the common interactions like? How do you initiate a conversation or respond when someone speaks to you?
Okay, in hospital English phrases, greetings, and questions, it's really all about initiating interactions and seeking information politely and clearly. Someone working at the hospital, maybe at reception, might ask you, "How can I help you?"
And how might you reply?
You could respond clearly, stating your purpose. "Hello, I am looking for the emergency department." Or maybe, "I need to see a doctor," if it's not a dire emergency but you need attention. Or if you're just visiting someone. "I am visiting my aunt, Mrs. Smith. Could you tell me her room number?" These are your basic entry points into navigating the hospital system for different needs.
Makes sense.
Ah.
And once you're interacting with medical staff, being able to clearly and accurately describe your symptoms is absolutely paramount for them to diagnose and treat you effectively.
It absolutely is. In hospital English phrases describing symptoms, the key is clear, concise communication about what you're actually feeling. Medical staff might prompt you by asking directly, "What are your symptoms?" Or perhaps more gently, "How are you feeling?"
And you could say,
You can then clearly state things like, "I have a headache, I feel dizzy, my stomach hurts, I have a cough." Being specific, even with simple terms, helps them narrow down the potential issues much faster and provide the most effective care.
right. And what about understanding what the staff asks of you? They'll often have instructions or specific questions for the patient during the process.
Definitely. For hospital English phrases understanding staff, it's about recognizing and following common instructions and providing necessary information when asked. You might hear routine requests like, "Please fill out this form," which is very common for admissions or collecting medical history.
What else?
They will almost certainly ask, "Do you have any allergies?" Because that critical safety question again. Or they might simply say, "Follow me, please," when they are directing you to an examination room or x-ray or somewhere else. Knowing these common requests helps you respond appropriately and efficiently, ensuring a smoother process for everyone.
Okay. And finally, just to reinforce those core emergency phrases, but specifically for use inside the hospital itself, when something truly urgent arises, perhaps while you're waiting or visiting or even as a patient.
Right. In hospital English phrases emergencies, these are the vital, urgent phrases designed to convey maximum urgency to the medical personnel who are already on site. Things like, "Call a doctor" if one isn't immediately present, or simply stating, "It's an emergency," to quickly escalate a situation you're witnessing, and the direct plea, "I need help immediately."
Same principle as before, concise and unambiguous.
Exactly. These phrases are designed to cut through any potential confusion in critical moments. Similar to the first aid emergency phrases, but tailored for use within the internal hospital setting where staff are nearby.
This has been an incredible journey today, hasn't it? Really comprehensive. We started right back at the very blueprint of the human body, meticulously decoding discomfort by looking at common symptoms and the specific roles of key professionals.
Building the foundation.
Then we explored that crucial toolkit of common treatments and the power of using urgent, clear communication in a crisis. We navigated the often complex hospital environment from reception to discharge.
Covered a lot of ground there.
We delved into deeper language with essential verbs and the different forms medicine can take, and even took those fascinating specialized deep dives into pediatrics and the intricate respiratory system. I feel like you, listening, have truly transformed from maybe a general learner into someone remarkably well-informed in the basics of medical English.
If we try and connect all this back to the bigger picture, you now possess, hopefully, a much more comprehensive mental map of the medical landscape. You're equipped with the vocabulary and the conversational tools to understand, describe, and interact much more confidently in a whole range of healthcare scenarios.
Yeah.
It's a powerful foundation for anyone looking to bridge that communication gap in medicine. It offers, I think, surprising facts, but also really essential insights that help make you genuinely well-informed.
It truly is. And thinking about all this now, considering how rapidly medical science evolves, new discoveries, new treatments, new conditions seem to emerge constantly. We're always on the cusp of so much change.
The pace is incredible.
It makes you wonder, what new terms and what new communication challenges do you think will emerge in, say, the next decade as medicine continues to advance? And how might our understanding of medical English itself need to adapt to keep pace with these incredible developments? How do we make sure we remain well-informed no matter what innovations lie just around the corner? It's a fascinating thought to end on, isn't it?